name is Brenda and I'm a training nursing associate. So what's made me want to become a training nursing associate was I've worked in care since I was 19, and I've done different type of roles in care, and I just wanted to try something different and work towards my nursing degree. I found the nursing associate course much more relaxing, easy, less stressful. I didn't have to worry about uni too much. I go to uni once a week. And also a lot of it is all hands-on training on your job, so that makes it a bit easier. Especially I felt like I wasn't very academic. I didn't feel like I like to read quite a lot, so going to do a lot of hands-on work on my placement, that made me much more comfortable. The requirements to join the TNA course, you need to have your 5 GCSEs in English, Maths and Science and other subjects that would be relevant to what you want to do for the training nursing associate. So for those who've done health and social care, that's also quite good. Or child development as well, I believe is also quite good. It can be used as well for the TNA. You don't necessarily need to have A-levels, but again, they're desirable if you've got other qualifications that, for example, if you've gone further in your NVQs in health and social care, that's still really good. So there is different ways of getting into the course, but the basic ones is to have your English, Maths and Science. A typical day for me would start off on the ward. We have handover. That usually takes about 30 minutes for the handover, and then I will prep my bay area that I'll be looking after, so you get an allocated bay. And during the handover, I'll be going through the patient's folders, looking at what needs to be done for them. So if they need to be weighed, because some people might be on daily weights, making sure all the paperwork is in the folders. So then before I go off to do my morning routine, which would be sitting up people ready for breakfast if they want to. So we're always making sure we're using a person-centered approach. It's just because around 7:30, 8 o'clock breakfast is served does not mean people have to eat at that time, but we just encourage them to. If they don't want to, we offer at a later time. So we just go with the flow of the patients. So between 7:30 to 8 o'clock, you're getting people ready to have their breakfast. After breakfast, you offer people washes or showers, depending on what they feel like and their abilities. And then throughout the day, you're doing turns if you need to do turns. Usually about lunchtime, after lunch, I will get involved in medication, so do the medication run with the nurse. Where possible, if there's people with dressings, I'll get involved with that as well, working with the nurses. So you get to see the nurse has their own little plan of what they need to do, so it's always quite good to communicate with them. So I usually say, oh, what you got planned for today? Are we doing any dressings? Do we have any procedures that maybe catheters need to be removed or cannulas need to be removed? So just knowing what needs to be done and then making yourself available for when those things are being done, so you participate in that, which is really good. Checking vitals, which is doing observations, pulse, respirations, checking their saturations as well as their temperature, just to make sure that they're stable. We also do blood glucose monitoring, which is for people who are diabetic or on certain medications. They need to have their vitals monitored, so to make sure that the sugar levels are not dropping or increasing above the levels of normal. And just recording and documenting everything that we do and how they are. So we do hourly checks to just make sure we're documenting every hour where possible, and just making sure everybody's safe and whoever you're looking after is safe and they're okay. One, I get to learn on the job, so that's my biggest thing, because I'm not very academic and I don't really like the uni stress. So for me, it would be being able to work and be able to learn on the job. That's my big one. Second is I'm actually getting paid to learn as well, so that's a really big bonus. I don't think I actually mentioned that before, but you actually do get that, so that's a really big bonus as well. I've got really supportive teams, so there's a lot of support for you at uni as well as on your job. So your managers, the education centre, and your other colleagues as well who are doing the same course as you, and those above you, they really are very supportive. I get to have fun, I get to meet new patients, I get to communicate with them. I like talking to people. I'm a big chatterbox and I enjoy doing that and getting to learn and know a lot about people, and also to having the opportunity to grow myself and to help other people. There are various challenges to my role. So initially, the biggest challenge I faced was because I was a direct entry nursing student, I felt that I was treated slightly different because I'm counted within the numbers. But you get to understand that that is because you are an apprentice and you are working as well as doing the course. However, through communication with my managers, the nurses I work with, it became better, and making myself available to learn at every given opportunity, that was another positive thing for me. So that was the biggest challenge that I had to face. But now, because I'm communicating with my mentors and my manager and the nurses I work with, I'm getting a lot more support and able to do a lot more nursing and clinical skills. So having started the course, I have had different encounters and I've had good days and bad days. The story I like the most is I've looked after a patient who was, there was a language barrier, but she was absolutely amazing. And every time I did something, she would laugh and she would make little comments. Sometimes she might say, "Oh, you look big," or "You look too skinny." And I'm like, I'm still one person, but it's okay. And it's just the fact that they just, there's no day that's ever the same. And it was just fun being able to come in and try and, just enjoy the day with them and just make the day fun and be silly and having part of activities. So part of our ward, they do quite a lot of activities. Like we were involved in the Queen's Jubilee. We did like different events. We had pet days. We've had quiz days. We've had different types of things, which is really fun to get involved with the patients, and that's really, really fun. I really enjoy things like that, and I also enjoy dancing. So that I do quite a lot of the patients when we play music. So we get Alexa playing music. And music is really good for patients, especially with dementia, so it's quite fun in getting them to dance as well as a way of getting them to walk with you, so it's quite nice. So yeah, those are my favourite bits. Well, hopefully finish my second year and then proceed and carry on to doing my further nursing to complete my nursing degree, and then see what the world offers after that. So apprenticeships are really good. They're flexible. You get a lot of support. People who do apprenticeships tend to, when you get onto the apprenticeship, they're investing in you. So they want you to pass. They're not setting up to fail. Also, you probably will have less stress in terms of finances because you don't have to pay for anything. But the big thing is you've got support, and that's the main thing that you want to have, is support in the right places. The education centre for me has been very supportive. When I felt down or felt really upset about certain things that have happened, I've gone to them, I've disclosed how I felt, and they've acted on it, and they would go in. If they need to speak to my managers, if I felt like I couldn't speak to my manager, they would go in and do that for me on my behalf, which is really good, because at least you know that outside of my department that I work in, I've got someone else that I can talk to, and outside in the same thing with university. So you've got 3 different points of contacts or more, and that's really good, and I found that really helpful. And that's the biggest thing I'd say, is the level of support that I've got, and also I don't feel as much stressed about it because, like I said, it's really flexible. They're very supportive. They'll help you all the way to get you to pass your course, and that's the main thing you want. Come and join us. We're waiting.